Miss Curtis, what was your experience like at Beacon Dental Center from the time you started with us until now?
Well, the first time I came in, I was very nervous because I've been in a lot of pain. But Dr. Sullivan said that I did not have to worry. There would be no pain, and I had none. And it's been very pleasant. The staff are wonderful, and so is he. And I've had no pain at all with my teeth being worked on all this time.
And where did you find us?
I actually found you on the internet. I was looking. I didn't know who to go to, and I liked all the email that he received from other patients, and especially the sedation dentistry, because of the pain I have been in before, and I just decided to try. So I came up.
So what made this experience at Beacon Dental Center different than any other dental office that you've been to?
Oh, how can I describe that? It's incredible. The caring staff and Dr. Sullivan, and the experience here has been wonderful. I just am relaxed after my first visit here, and knowing there was not going to be any pain. And it's been incredible. Everybody's been just wonderful.
So what's your favorite thing about coming to the dentist?
There's just such wonderful people here. They really do care about you. Whether you're here or you're home, they give you a phone call. And I think what's so amazing is there's no more pain. There's no more fear. You don't hear that drill that we were all so afraid of when we were children, and then developed this fear and anxiety of going to the dentist. It's gone. It's wonderful to come here. I enjoy coming here. Who enjoys going to the dentist? Penny Larson does.
Jack, what are you doing?
Laughing.
Oh. Who taught you how to do that?
Ellie.
Oh.
Ellie.
Show me again. Good.
Hi, I just had some fillings done. I'm talking a little funny because I can't really feel my tongue. I can't believe that I've had 7 fillings done. It just doesn't seem possible. And 2 of them were pretty serious ones. And hello, it's springtime, so thank you, Dr. Sullivan. You made it bearable, beyond bearable.
I just got my tooth pulled by Dr. Sullivan.
And how was that different than the last tooth that you got pulled?
Oh my goodness. What an amazing, wonderful experience. I cannot believe I even had my tooth pulled. Completely different from the way they used to do it. Thank you, Dr. Sullivan.
So, last time we saw you, you weren't too keen about coming to the dentist's office, were you?
No, I came in here crying.
And how do you feel now?
I feel like a moron for coming in here crying.
Are you out of pain?
Yep,
Was it easy?
it was very easy. I could not believe it. And everything just went very smoothly. I was explained everything, and before I knew it, tooth was gone. And
What'd you just say?
we drive over 2 hours to get here, and I will never go to another dentist in my life.
That's
I've
wonderful.
got one 3 miles up the road. He's a butcher. So, I'll go see him. I'll come see Dr. Mike
Great.
every time.
What are you doing?
Yashin?
Oh, you are? Did Jen teach you how to do that?
Yeah.
She did?
Yeah.
Did you practice that? Show me some more. Oh, that's very good. Good flossing.
Okay, Miss Miller, what do you think about Beacon Dental Center?
I think about Beacon Dental Center as one of the finest places in Charlevoix. It is the people here are considerate and loving people, and they do excellent work, and they are very helpful. Everybody that works here. And I think Dr. Sullivan has done a tremendous job. I even let our former dentist know, who lives in North Carolina, and he had lined up Dr. Sullivan to take over his job when he and his wife left to go to North Carolina. And I have written to Dr. Merrill, and I have told him what a wonderful thing he did for us to get Dr. Sullivan and his staff. The whole staff, they're considerate, they're caring, and it is a pleasure to come here. And we are very fortunate.
Okay. What I would like to say about the experience over here at the Beacon Dental is it's the first time in my life that I've had the pleasure of going to the dentist. I usually shy away and will not go. I'm scooping it up here.
It's okay, you can start over if you want.
Okay, I better start over. But that's basically it. I've enjoyed coming to this dentist. I enjoy Dr. Sullivan and his whole staff. It's the first time I've had a pleasure of going to the dentist. And it's just, you guys just make you feel welcome.
Why didn't you like going to the dentist in the past?
I didn't trust the work that was being done, and rather than take care of my teeth, they usually pulled them. And sometimes when I was at a pretty young age, like even 12, they started pulling teeth, just because I don't know why. I don't think they wanted to fill them if I needed a filling. So it was a pretty poor experience for me as a child, and I just now got around to having things taken care of like it should have been done years ago.
And Dr. Sullivan's done that?
Dr. Sullivan has done that. His whole staff is wonderful, and I trust Dr. Sullivan 100%.
I just had 3 cavities filled by Dr. Sullivan with a procedure I'd never had done before, and it's perfect. I can't even feel that he had done the work. It's excellent.
CEREC is a cutting-edge technique and technology that I use here in my office for my patients. When a patient needs an ancient filling to be replaced, or they have a broken tooth and they need a new tooth, we can use this technology to make them a new crown in just one visit, as short as an hour to an hour and a half. What we do is we take the ancient filling out of the tooth, or we get the tooth ready if it's broken, shape it so that it can have a new tooth built on top of it. And I use this computer with a special camera that's attached to it to take a picture of your tooth. And then I design a new crown or a new tooth on the computer using some CAD/CAM software. I send the message wirelessly to this, which is the milling unit, and this cuts the new tooth out of a solid block of porcelain that's been perfectly shade matched and selected just for your tooth. The great part about using this is there's no impression, so no more ooey, gooey, messy, gross tasting impression material that you have to let sit in your mouth for 5 minutes. Using this, we just take a picture of the tooth and we design it from there. The other great part is there's no more temporary, so there's no second visit, there's no getting anesthesia twice. It's all done today, here, now, right in our office, and we get you back on the road and back to your day, right here, right now, with a brand new tooth. Anxiety and the fear of coming to the dentist is something that I deal with every day, because a lot of patients come to see me specifically because of the techniques and the training that I've had to handle anxiety when visiting the dentist and having your teeth worked on. Some of the things that we can do, we use Bose noise cancelling headphones to block out the sound that's in the dental office, whether it's the suction lines or the hand pieces. You have a flat screen monitor tilted over your head in a position so that you can see it while you're in the treatment chair. We also give you a nice warm blanket so that you're comfortable and warm and cozy and kind of tucked into the chair while you're here. And having a warm beverage or a cool bottle of water can make all the difference in knowing that you're in control while you're here. We use different techniques like laughing gas or nitrous oxide. The laughing gas and the nitrous oxide, that helps to take the edge off. It also relieves some pain, so it's like having some Tylenol. And the great part about laughing gas is as soon as we turn it off, it stops working, so you can drive and go about your day as you normally would. We also use medication, so you can take a small tablet and have that with a bottle of water, and 30 minutes, you're carefree and ready to have your work done. We also take it as far as using IV conscious sedation, where I start an IV in the back of your hand very gently, and we use some medications so that you're 100% comfortable while you're here. You're asleep, you won't remember being here or having the work done, and it makes it that much easier to know that you'll be 100% comfortable while you're having it done. Dental anxiety, the fear of going to the dentist is something that exists, according to some research, in as much as 75% of Americans. So it's something that's very prevalent, and it makes a major difference in patients' experience to have a dental team that's well trained and a doctor that's had some advanced training and patient comfort to make their experience just right while they're here at the dentist.
When she asked me what the worst part of this deep cleaning procedure that I had gone through, I had to think for a minute, and I said, I think it was the anticipation based on past dental experiences, never having had this type of a procedure done before, but just past times at the dentist office, which weren't terrible, but just one that did not make me want to go back. And so I was a little, apprehensive. I thought, oh, geez, but then I thought back to my very first visit and then the second visit, and I thought, well, it's been so relaxing and so nice that I shouldn't have any apprehension. So now coming to today for my second phase, piece of cake, I guess you could say. I really, and my mouth feels so much better, even though there hasn't been that much done, but still I can tell how I'm feeling about myself and my mouth. I guess that's the thing.
Oh, that's great. Thanks.